My name is Fabio Denisi. I'm the Associate Director of Neurology at Mid-Hudson Regional Hospital, part of the Westchester Medical Center system here in Poughkeepsie. And I'm an Associate Professor of Neurology at New York Medical College. I'm here to talk to you about stroke with an emphasis on prevention. I'm going to intentionally keep my slides pretty short and do mostly talking. And I'm happy to entertain any questions that you can send to me via the links that you'll be provided to later. So let's start talking about stroke. Stroke is a neurological condition, obviously, due to damage to brain tissue from either sudden clogging or bursting of an artery within the brain. So basically what we have is 85% of people who have a stroke because an artery gets clogged. And for some people, it's because there's clogging, there's atherosclerosis, there's a partial narrowing of the artery in the brain itself. And that partial narrowing, that partial clogging in the artery in the brain itself suddenly gets worse, and it clogs all of a sudden. It's kind of like when you have the drain in your sink that's already kind of partially clogged, and something happens and then it clogs all together, and then the sink spills over. So that's what we call a thrombotic stroke, and that's pretty common. And another common subtype of stroke where there's blockage of blood flow to parts of the brain is what we call an embolic stroke. And an embolic stroke is when you have clogging of an artery because of a clot that peels off from someplace else. Often it's the heart, sometimes it's the carotid arteries or other parts of the body. And that clot travels up the blood vessel, up the vascular systems, up the blood vessels in the arteries, and gets to smaller and smaller arteries until it gets stuck in an artery that's too small to let it pass any further. And so that clog basically clogs that artery, and that's what we call an embolic stroke. That's often what we see when someone has a heart rhythm problem and they form clots in the heart, and the clots peel off the heart, gets pumped up the arteries until it gets to the brain, and it clogs an artery in the brain. And that is what we call an embolic stroke. Of course, there are 15% of strokes which are what we call hemorrhagic due to bursting of a blood vessel. And those are treated very differently, but can present in the same way. Now, about 795,000 strokes happen in the United States every year. So think of it, almost 800,000 strokes per year. It's the number 5 cause of death in this country, killing more than 140,000 people every year in this country. It's the cause of 1 in 19 deaths, and is one of the highest causes of morbidity. In other words, long-term disability for those who survive stroke. So just to go back to what I was talking about before, if you have a normal artery, there's no problem with blood flow. And I wonder if you can see my pointer, but anyways, if you have a normal artery, if you have a normal artery, you have no problem with blood flow and everything's okay. If you have atherosclerotic plaque, that atherosclerotic plaque can suddenly rupture and have deposition of platelets and fibrin and other products. And that rupture causes a sudden clogging of the artery, which was only partially clogged, is now suddenly clogged. And because of that, all of a sudden, you have interruption of blood flow, and the brain tissue that requires that blood flow stops working. Now, if you're lucky enough, that blood flow will be restored fast enough so that there isn't any permanent damage. In other words, you can have symptoms that then go away. And that's the basis of what we call a TIA, otherwise known as a mini stroke. In other words, if a blood clot unclogs fast enough, then blood flow is restored, and that part of the brain which was stunned starts working again. If a blood clot doesn't unclog fast enough, then that part of the brain that was initially stunned basically dies, infarcts. So just like you have a heart attack where you have blood blockage to a coronary artery that leads to damage, death of muscle in the heart, a stroke is the same thing. You have blockage of a blood vessel to the brain that leads to first malfunction of that part of the brain, and then actually death of that brain tissue, loss of that brain tissue. And that's irreversible. And everything about treating stroke is to get to this blood clogging, blood vessel clogging fast enough so that we can undo the clot blockage, take away that clot if possible, and restore blood flow. And if we do it fast enough, then we can restore function to the brain. That is the essence of treating a stroke if and when it happens. Now, keep in mind that when a stroke happens, if a blood vessel is large enough and the territory of the brain is important enough, you'll have symptoms. So often you'll have symptoms like facial weakness, weakness on one side of the body, difficulty speaking, visual problems, balance problems, and so forth. And so those are all typical symptoms of stroke. But sometimes you have strokes that are so tiny that you don't notice. And that's why it's so important to talk about prevention. You can have strokes that are so tiny because you have many risk factors that we'll talk about in a second, that you don't notice that you're having a stroke, but they damage a tiny little part of the brain. And if you have damage to one little part of the brain one day, and the next day you have another tiny piece of brain that's damaged and goes unnoticed, and again and again and again over years, that can lead to problems with brain function as well. It's a different kind of presentation than a classical stroke where all of a sudden you develop weakness on one side of the body, but it can present with cognitive decline, problems with memory, problems with thinking, and also problems with balance. So just please keep that in mind. Not all strokes are visible, and you can have little strokes that add up over time without noticing them if you don't address your risk factors. So let's go over some things. Let's review some things that we talked about already. Number one, stroke kills brain cells. Okay, this is so important. Stroke happens when a clot ruptures or interrupts blood flow to the brain, and brain cells are the most dependent on oxygen. That's why if you have like someone who had a near drowning event, if we're able to revive the rest of the body, the brain may not be able to recover as well, because the brain doesn't have its own store of energy. It doesn't have its own energy reserves. So you cut off circulation, that's it. Fact number two, there are different types of strokes. 85% of strokes are caused by a clot, a blockage of blood flow. 15% of strokes are due to hemorrhage or rupture in a blood vessel. Fact number three, if you had a stroke, that puts you at very high risk for another stroke, because whatever led to the first stroke is going to put you in a high risk category for subsequent strokes. Fortunately, we can do a lot of prevention, and that's where fact number four comes into play. Prevention is key. If you had a stroke, you have to work on preventing the new ones. And part of it comes down to, appropriate medications, for example, aspirin or some other medications that your doctor may prescribe. And a whole lot of it has to do with lifestyle. And this is the mnemonic that the American Heart Association is promulgating. It's called FAST. And actually, sometimes we use FASTER as a memory device. F is for face, like facial weakness, facial drooping, facial asymmetry. A is for arm weakness. S is for speech difficulty. T is for time. And then E is for equilibrium. So you can have some problems with equilibrium as well. So remember that some strokes don't present with facial droop or arm weakness or speech difficulties. Some strokes present with problems of equilibrium, problems with coordination. Some strokes present with dizziness or problem swallowing. And time is brain. Every second that there's a clogged artery, there are many, many thousands, if not millions of brain cells that are lost. So every second counts. I can't say how many times I've seen people in the emergency room who waited to see if their symptoms got better before deciding to go to the emergency room, losing that window of opportunity through which you can treat a stroke. So let's talk about the various risk factors. Now, there are some non-modifiable risk factors, and those are the things you can't do much about. For example, ain't nobody getting any younger. Age is a big non-modifiable risk factor, especially when you're above 70 or 80. Ethnicity. There are some ethnic groups that are higher risk than others of developing stroke. For example, African Americans are more likely to have strokes than Caucasians. East Asians, for example, are more likely to have hemorrhagic strokes than other ethnic groups. Gender. Men are more likely to have strokes than women, and that's especially in the older age groups. And that's a function a lot regarding the role that testosterone plays in vascular risk factors. And so gender is an issue of stroke, but it's also an issue of other vascular pathologies such as heart attack, heart disease. And genetics. Some folks have a strong family history of vascular disease, of heart disease and stroke. There are some rare genetic disorders that predispose people to clogging of arteries, predispose people to having circulation problems. And all these things are at this time really things that we can't adjust. So let's instead focus on modifiable risk factors. And here are some of the biggest. And we have some other risk factors that I'll talk about as well. But here are the biggest ones. High blood pressure. High blood pressure is the single most important treatable risk factor for stroke. And it's very treatable. There is usually no good reason not to keep blood pressure under very good control. It's very rare to find someone who has high blood pressure that can't be better controlled with a single or a combination of medicines and lifestyle changes. Part of the problem sometimes is that if people have high blood pressure that goes untreated for too long, what happens is your arteries get tighter and tighter trying to contain that blood pressure. And then when you do finally try to intervene to lower the blood pressure, the arteries lost their elasticity, or they lost their ability to relax, to stretch out and get tighter depending on your needs. And so when you drop the blood pressure to quote unquote normal levels, people feel dizzy or lightheaded or have other side effects. So it's really, really important not to let blood pressure go untreated. It's really important to address high blood pressure early on so that your arteries don't stiffen up and you don't develop side effects from trying to treat blood pressure when it's too late. What are the things that we do to treat high blood pressure? Well, first and foremost, blood pressure is responsive to things like your weight. So it's very important to keep your weight down. Another thing that blood pressure is very responsive to is to salt intake. So it's important not to eat too salty. Another issue is exercise. Exercise is of vital importance in managing any vascular disease, any problem with your blood vessels. And I've heard people say, yeah, I exercise. I keep busy around the house. That's not exercise. Exercise is, for example, a brisk walk, a rapid walk where you can keep a conversation going, but otherwise you're breathing pretty hard. So you want at least low to moderate intensity exercise. Even better, you should do some high intensity exercise where your heart rate goes up, you break a sweat, you can't sustain a conversation because you're too busy breathing. It's never, ever, ever too late to start exercising. As long as you use common sense, you could be 65 years old and never exercised in your life, and you can start exercising. Exercise will substantially lower your risk of clogged arteries. Exercise will substantially improve mood, sense of well-being, and improve sleep for those of you who have problems sleeping. And exercise is known to lower blood pressure and lower cholesterol. So it's all good. Smoking. Smoking is another risk factor for stroke, and it's obvious that smoking is bad for you. I can just rattle off a few things that smoking does that is bad for you. Smoking makes you look bad. It gives you wrinkles. It makes you smell bad. Smoking leads to atherosclerosis. Smoking leads to throat, tongue, and lung cancer. Smoking leads to vascular dementia. Smoking is associated with chronic back pain. That's a fact that very few people really realize. Common back pain is very, very common. Chronic back pain is very debilitating. And among the risk factors, there are very, very few risk factors associated with chronic back pain. Smoking is one of them. The other ones are, for example, obesity and inactivity. So smoking is extremely important risk factor for stroke and heart attack, by the way. And in Sweden, in one study, about 39% of strokes were attributable to smoking. So kids, don't smoke. Diabetes. Diabetes is a condition which affects the entire body. It's a very disabling condition. Having diabetes basically doubles your risk of stroke compared to those who don't have diabetes. And of course, we know that diabetes causes all sorts of damage, but it causes damage to the large blood vessels and to the small blood vessels of the brain and predisposes you to those clogged arteries that I was referring to. The same for high cholesterol. High cholesterol predisposes to clogged arteries. Now, there are some other risk factors for stroke that I wanted to mention. For example, having atrial fibrillation, where your heart rhythm is irregular, predisposes you to stroke because clots can form in part of the heart and then peel off, which is why, and then clog an artery upstream, which is why people who have this condition often use blood thinners. Migraineurs, interestingly, are slightly at higher risk of having strokes. People who have obstructive sleep apnea. Obstructive sleep apnea is that condition whereby you snore because air has a hard time getting into your lungs during sleep because your tongue falls back and clogs up your upper airways. So sleep apnea isn't a sleep problem. It's a breathing problem in your sleep. So obstructive sleep apnea leads to a surge of adrenaline and other chain of events in your sleep that ultimately damages selectively brain circulation. And by the way, sleep apnea is associated with being overweight, which goes back to the importance of regular exercise, healthy diet, and maintaining a healthy weight. So obstructive sleep apnea is another risk factor for stroke. But like I said, the most important thing, by all means, is staying healthy, exercising regularly, keeping your weight down, healthy diet, of course. It goes without saying. I hope you don't have to hear from me what a healthy diet constitutes, is made of, and avoiding these risk factors. And so I have just a few seconds left. Just so you know, there are treatments that work, but the faster you get to the emergency room, the quicker we can start these treatments. Some treatments are Roto-Rooter therapies, where you get injection into your veins of a medicine that unclogs all the clogged arteries. And some treatments, basically threading a little catheter all the way into your brain, and that catheter grabs a clot and pulls that out of your artery. And so that's what we call endovascular clot retrieval. And that is something that is done for certain kinds of strokes. And thanks to these treatments, we can make a major impact in treating strokes that come to us in time to the emergency department. And with that, I thank you for your time and attention. And again, if you have any questions, you'll have a link where they will send me the questions. I'll do my best to answer all of them. Thank you very much.